So again, my name is Elizabeth, and I am one of the facilitators for Blue Matter Project, and work through a lot of the administrative back end. I've been with Blue Matter for maybe 6 years now, so quite a bit of time. Yoga instructor working in Toronto full time. And we are doing this new project, of course, where we're doing online meetings and giving this material for free. So we're doing our best to kind of support our community at this time. Yeah, I really want to bring Chris on. He is the director and founder of Holistic Connection. So Chris, please feel free to introduce yourself.
Hi, everyone. So like Liz said, my name is Chris. I have been a registered massage therapist for 10 years. I'm the founder of my company called Holistic Connection. And right now is a very, unprecedented time for us to really just kind of stay at home in hopes that we can stop this curve flatten the curve, but we're also having to adapt to different postures and positions. So I know that creates a lot of tension with everything that's happening. And then here I come along with a ball and possibly a foam roller that we might need and a mat. So I'm here to offer some help to you guys in releasing that. So if that sounds good, I'd like to get started. But before that, I think we got some questions to answer. Well, I have some questions to answer.
Yeah, I just wanted to say again, thank you for collaborating with us at Blue Matter Project. And you already said, you've been an RMT for 10 years now, which is amazing. And I've also had treatments with Chris. He's top notch. So if you feel afterwards, keep this contact as someone to see in Toronto. He has a business on King Street that's not so far away. So you can definitely go see him for RMT and acupuncture as well. I just wanted to ask you maybe what your interest is with the mental health sphere and why you thought collaborating with Blue Matter Project is a good fit.
I love this question, and mental health, I think, really has there's no shyness in terms of talking about it and providing help to bring that up to the surface. And the reason why I really like the Blue Matter Project is because I was really drawn to first off, I love the color blue, but I also just appreciate the openness to help others where, it doesn't seem as inviting as, say, going to get a massage because of physical pain. We all have some form of pain, and when a client is on my table, I can hear the mental health pain. And, that's out of my scope. It's not my scope of practice. So having a network like the Blue Matter Project and having Liz on board as well, that really provides sort of a connection for me to refer my clients to. And, being a patient of mental health as well, it has shown so much benefit, not even just within my personal life, but even my professional life. And Holistic Connection, as I sort of talk about it from a non-plug way, it really isn't just physical. It encompasses so much, and the mental is a big component of that. So this whole bit of just sharing this knowledge with you guys is just on the physical end, but that has to come from sort of that, the stress that we're feeling from the unknown that's going on right now. And, for instance, like this morning, I woke up with a little bit of anxiety. So I had to actually get onto the floor and get onto the lacrosse ball, and I was able to sleep again. So, sometimes it kind of catches up.
Definitely. I hear you with that. I actually didn't sleep at all last night. Also woke up with that same anxiety. And I think the name of your company really speaks to all of that you just said, the name being Holistic Connection. The physical practices are kind of one aspect, and then we have the mental health aspect where we maybe see a therapist or psychotherapist, whatever it is, but really trying to find ways in which we can connect those two holistically is super helpful. So having this dialogue with other practitioners in different fields and really coming together is super important.
So important. And it's really fun. It's really fun too, because things that I isn't in my scope of practice is really cool to learn from other scopes of practice like mental health. It's, you know, how mental health healers kind of help their clients and patients. It's really cool to see, because that's not obviously something I do, but I act like a concierge to allocate them to you guys.
Awesome. And would you mind just telling us why you think today's session is really important? Why is self-massage a good tool for your toolbox?
Well, since you guys can't actually get to your possible therapist right now because of what's going on, we are all sitting at home, either getting comfortable on our couch, becoming a lot more immobile, or you're doing the opposite, where you're joining kind of the online classes, the big trend that's going on. So you're quite active. This is one way of just maintaining your physical health in terms of your mobility, decrease pain and tension. Some of us can be experiencing headaches. That's why today's class that is going to be focusing on neck and shoulders is going to be very helpful. I'm very passionate about muscles, and I'm also just very passionate about helping people. So combine the two, you got this class.
Awesome. Well, we're excited and ready to get going. So feel free to take the reins from here.
All right, awesome. Thank you, Liz, again. So just like any other treatment, we're going to have to kind of be self-aware today with the self-massage. So we're going to do a self-assessment. And by self-assessment, I mean we're going to do a few movements with our neck and shoulders. So what I ask for you guys to do is just be aware of what your body is saying. So if you have some limitations or imbalances from one side, the right versus the left, just keep note of that. Unfortunately, I'm not there to kind of actually write notes, but this is an opportunity for you guys to just create some self-awareness. So we're going to start with some neck movement. As you are, either you're sitting or you're standing, just stand or sit nice and tall here. And what you're going to do is you're just going to rotate your head to your right side, and you're going to pay attention to where that chin falls short, or what's right underneath it. So as you are just rotating to your right, just stay there and keep note, where does your chin fall? Is it over your collarbone, or is it just shy of it? Okay, now we're going to flip it to the other side and turn. And so here, do you have any imbalances? Does this side actually have more increased range of motion or decreased? Okay, so that's something to take notice. And you come back to the center, and if your chin happens to kind of, if I can show you, if it falls short, say on my right side, and my left side moves forward more, we're gonna have to release obviously the right side a lot more. Next thing, we're just gonna bring right ear to shoulder, and I wanna watch you guys do this here. And here's some self-awareness tips, or a life hack, is just to keep note of what your shoulders are doing. So let's start this from the very beginning. Let's keep our shoulders kind of squared to ourselves, not kind of tilted. And you're going to bring right ear to shoulder, keeping that nose centered, not rotating, okay? And if your shoulder on the opposite wants to creep up, we got some tension, okay? So let's bring it back center, left ear to shoulder. Try to go as far as you can. Okay, and take it back center. Really light stuff there with the neck. We're going to do some shoulder mobility here. So I'm just going to back up. You don't have to. What you're going to do is just going to raise your arm all the way up. And I want you to bring your arms so far back. Okay, good. Now keep note, if your arms are in front of your ear or behind your ear or just perpendicular, or sorry, parallel to your ear. Okay, I like to use the ear as the sort of cue to how far my shoulders can go. Okay, so sometimes in the morning, if you know your muscles can tend to be stiff, I like to just check my range of motion. So throughout the day, I'm doing this just to see how my shoulders are feeling, because as a massage therapist, these are kind of important. So let's do one arm at a time. Okay, and this time you're going to bring your right hand, to cup your shoulder. Now I want you to keep note of what that elbow did. Did it move? Did it stay where it was, or did it move forward? Okay, so we're gonna do that again. Arms straight up like this. Try to get it kind of right by your ear. Should do it this way. And hand to your shoulder. Does that elbow sink down? If so, could you move that elbow towards the ceiling without arching your back? Okay, and if you do, here we have some tightness in the lats, which we're going to release today. Okay, so let's release that. Left arm above your head, bend. So here, for instance, for myself, I actually have a lot more range of motion here versus I do on this side. So if you actually do both arms, bring it down, sometimes you'll notice one arm will sink down, okay? Just something to take notice there. Last but not least, I'm going to show you what this looks like first. Just trying to grab your hands from both sides. So we're going to take right arm above on the top, okay? And if I can actually, for those who are showing themselves here, if I can actually see it, actually don't worry about it. We'll skip that part. We'll do it, but you don't have to show me. So for you guys, just to create some self-awareness, just see if your one motion is different than the other, okay? All right, because we're gonna have to reassess at the end. All right, let's just get to the self-massage component. So now you're kind of aware of what your arms and your shoulders and your neck can do, or what's feeling tight. I want to start off with working the front of our body first. So a lot of us are either, if you're working at home, sitting at a desk or sitting on the couch, or worse, just sitting anywhere for a long period of time, a lot of the tension builds up here. So we're going to have to release this first before we get to the neck and shoulders. So we're going to start off using the fingertips, find the collarbone, okay? And we're going to hit just underneath it, okay? So I should have worn something a little bit more revealing, but just underneath your collarbone, you're going to actually push right into it, okay? So push your fingertips right into it. Apply some pressure. Keeping your mouth closed, you're going to pull down and you're going to look up. And what you should feel is a stretch from the collarbone. And bring it back down. And what we're going to do is reposition, going out a little bit further wide. You're going to pull down and look up. I'll hold this for 3, 2, 1, and come back center. Last position, we're going to go out a little bit further. So the end of that collarbone, okay? So not too far off, but just kind of shy of it. So pull down. You might actually have to kind of pincer grab like this, and then pull down and look up for 3, 2, 1. Okay. So just relax there, shake that off. And what we're gonna get you to do is, you know what, I wanted to do this on the floor, but if you have access to a wall and if you have to reposition your device, please do so. I'll show you what I mean. Where did my ball go? Okay. You're going to use the lacrosse ball and we're going to release the pec muscles, okay? Very specifically, because the pec is a big muscle, we're going to target one specific spot. So I'm very picky on positioning. So feel your collarbone, okay? Feel it right to the end, okay? And what you're going to do is just sink down, and right in between, this is your armpit fold. That's not an actual name. It's called the axillary fold. So right in between, okay, where that collarbone end line here is right in between, you're going to go an inch in. That's where I want you to place the ball. You're going to find a lot of fun stuff to release there, and by fun, probably tender. So you're going to get onto the wall. So once you're kind of positioned to the wall, so let's release the right side first, okay? You're going to go right leg in front of you. You're going to go perpendicular to the wall. Place the ball on that spot that I mentioned and body check that ball into the wall with your right arm midway. So you kind of look like you're doing a pec stretch, which actually it is. And you're body checking, you're putting all your body weight into the wall like that. Now place the left hand onto the wall midway. Okay, so you kind of look like this. Before we do anything, I'm just going to get you to just look. What we're going to do, what is going to engage this release is going to turn towards your left shoulder. I'm using my left hand to push my body away from the wall. Okay, while I'm pushing that ball into the wall. So body check the ball. Here we go. And you're going to rotate, look over your left shoulder if you can. Hold this for 4, 3, 2, 1. Bring yourself back center. Now place the right hand down, place the left hand up. You're going to rotate again. Now you're going to look up towards the ceiling. Hold this for 4, 3, 2, 1. Bring it back center. Place the right hand on towards just above your head, not too high, and left hand on the bottom. And you're going to rotate, push that ball into the wall. Look down towards the floor. Hold for 4, 3, 2, 1, and release. Bring it back here. Remove the ball. And just give yourself a good pec stretch from this position by also rotating. Looking past your left shoulder, holding for 6, 5, 4, 3, 2, and 1. Relax. Okay, let's do the same thing on the left side. This is my left side here. Don't know how it's mirroring through the video. So, again, left foot in front of you. It's like a dance. Left foot in front, left arm on the wall. Place that ball right in that pec area. Find that good tenderness. Find some pain. It's okay. Your body can take it. Right fingers and hand on the wall. Rotate. And breathe for 4, 3, 2, 1. And bring it back center. Place the left hand down, right hand up, and rotate towards your right shoulder. Look up. 4, 3, 2, 1, release that. Left hand on the top, right hand on the bottom. Rotate, looking towards your right shoulder again. Breathe for 3, 2, 1. Bring it back center. Release the ball. I'm just holding it. Also placing my right hand on the wall here. Left hand, just give yourself a good stretch by rotating again. Rotate further for 6, 5, 4, 3, 2, and 1. Release. Okay. Still sticking to the wall, we're going to release what's called the lat muscles. This is the biggest muscle of your body. So it's essentially your back. Now, what you're going to do is, I don't know if you can see this, but my right hand is extended all the way to the top. Okay? Now this can act like a stretch, or if you want to be, dare I say, ballsy, you're going to place the ball right on towards this area that's just underneath your armpit and in between like that really, really bony area that's called your ribs. So you're not going to go where the ribs are. You're not going to go in the armpit. That's just weird. So you're actually going to go right in the middle. Okay? So you're going to find yourself to body check that ball into the wall the same way you're doing with your chest. Hand. And what you're going to do in terms of positioning is you're going to go up and down like an elevator. So let's go down and allow that ball just to kind of find all those really sticky areas. Okay, so we're going to go 5 reps here. 5 reps down and up. This is 4 and up. This is 3. Feel free to explore the area. You can also 2. You can also rotate in or away. Everybody's body is different. And release. Now just hold that ball with that left hand. Allow your fingers, your right fingers, to kind of reach up a little further and think your armpit is just going to kind of connect with the wall. Just stay here. And I want you to rotate your body inwards towards the wall and away. So we're kind of swinging and rotating. You can do as many here. Just to wake up that lat muscle. And bring your arm down, release. Same idea, now on the left side, okay? So place the ball center point between your armpit and your ribs. Left hand all the way to the top. Body check the ball into the wall. And bend your knees to go down. That's 5. Down. This is 4. 3. 2 more. And 1. So let's stay right here. Remove the ball actually with your right hand, just hold it there. Left fingers are just gonna climb just a little higher, okay? And armpit sinks right into the wall and sink yourself down just a little bit by bending your knees and just stretch here. Hold this, 4, 5, 4, 3, 2, and 1. I apologize. You could swing as well or rotate your body if you like. But let's move on. So shake that all up. All right, cool. Now let's just come back to the mat, or let's actually not come back. Let's get onto the mat and take your trusted ball. You guys doing good so far? Just give me a thumbs up for those who are showing video. Cool. So what did I have in mind for you guys today? Aha, all right. So everyone loves getting their upper traps worked on. So if you don't know what we're going to focus on, allow me to kind of be a bit of a geek. I like to show the muscles so you know what to target. Now I'm going to rotate. This is everybody's body. You see this big muscle here? This is a big muscle. We're not going to release all of that. We're just going to release this sort of triangle here. Okay? I'm going to do it one at a time. Everyone likes getting this worked on, but no one really likes it getting treated. So bear with me here. This one's probably going to be your probable favorite. So come to the floor. Sit like this. Place that ball. Find a good spot before you place the ball, actually. Find a good spot where you want to place the ball. And once you find something that makes you go, ugh, that's the spot you want to place the ball. So place it there, and you're going to come down towards the floor. Okay? Make sure that that ball is underneath that muscle, even if it's just a little bit. Hands, left hand especially, just down towards the floor like this. Okay, palms face the ceiling. Feet, close, heels closer towards your butt. You're going to take a breath in, and on the breath out, you're going to lift your pelvis up like this. Okay? Now, at this point, if you don't feel the ball right underneath that muscle, feel free to just adjust that ball. And once you find that spot, we're not done here. You're going to place that left arm just right in front of you like this. Okay? And we're going to make circles. Bend the elbow as you do it, like that. Okay? We're going to go 6 of these. So bring it back up. This is 5. Feel free to lift your pelvis even more so you can get deeper into that trap muscle. That's 3. 2 more circles here. 2. And 1. Release your arms, release your pelvis. Bring it down towards the floor. 2 different positions on that same muscle. So now switch that ball, reposition I mean, and just find another area. Okay? Give you a few seconds to find it. Once you do, I don't know if you could see the ball right underneath me. Okay? Once you do, lift the pelvis up. Probably should feel it right now. Just take a breath in and breathe out. Take your arm in front of you and make those circles again for 6, for 5, for 4. Don't rush the circles. 3. Please breathe. 2. And 1. And bring your pelvis and arm down. Okay, we're gonna pick one more spot, but I invite you to kind of explore. Now, don't get up, this is just me. So the base of your neck, where it meets the shoulder, that's where I want you to place the ball, okay? So base of the neck, find it, go down, 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 where it meets the shoulder, place that ball right there, okay? We're gonna go pretty aggressive on this spot. There's a lot of release is needed here. So lift the pelvis up. Breathe in here. If you're not breathing, you're holding tension. So arm up above your head. This time we're going to make big circles. Keep that arm straight. Don't bend the elbow. That's 1. We're going for 6 here. 5. Like big backstrokes in the water. 4. I lost count, but we're going to go 3 more. 3. Oh gosh. 2. And 1. Okay, and bring your pelvis and arm down. relax. Take a bit of a breather. You need to shake that left shoulder or the area that you worked on. Please do so. Get some blood moving through that muscle. I'm going to do the same thing on the right side. Okay? Let me just switch for you guys. Okay? Again, we're going to have 3 positions for where that ball is going to be placed. Let's go up. Take a breath in here before you go up. And breathe out. Lift your pelvis up. Arm above your head. And bend the elbow as you make the circle. For 6. For 5. For 4. For 3. Keep going. Doing great. 2. And 1. Release the arm and pelvis down towards the floor. Pick another great spot. And by great, I mean no, not great. You guys are doing great though. That's what's great. So lift your pelvis up. Arm above your head. Here we go. 4, 6, 5. Wow. 4. I dare you to lift your pelvis higher. 2. Good job. And 1. Arms and pelvis down towards the floor. Last position, base of the neck where it meets the shoulder. Put that ball right there. Lift your pelvis higher. Arm above your head. No bending of the elbow as you bring it down. 6. Backstroke here. 5. Big circles. 4. Breathe. 3. 2. Last one. Let's make it good. 1. And bring yourself down. Relax. Remove the ball. Shake it off. Yeah. Cool. Now, I'm coming up. Stay down. Stay down, guys. So now we're going to put the ball in between the shoulder blade and the spine. These muscles often get pretty tight, especially if we aren't engaging them actually. So it's funny because if you are kind of crouched into this position at work, at home, or just sitting on your couch all day, those muscles don't get contracted. So we're gonna just wake them up with the ball. All right, so here, onto the floor. Oh, let me go this way. Place the ball in between your shoulder blades, in between the shoulder blade and your spine. We're going for the left side. All right. Okay, and here you don't have to lift your pelvis up. Thank God, right? And what you're gonna do, so if you see the ball right underneath me, you're gonna take that left arm and open it up, okay? So my feet are just planted on the floor. You don't have to, you can relax them, whichever way is comfortable. Now that left arm is gonna go across your chest. Whew. Okay? And bring it back up, open. That was just a trial, so we're gonna go for 5 of these. Here we go. This is 5, cross your chest. And open it up. Let's go with a little slow tempo here. 4. And breathe it in. Breathe it out for 3. Breathe it in. Breathe it out for 2. Breathe it in. Last one. Let's go a little slow here. Breathe it out for 1. When it's at the end, what I mean by end point is it can't go any further. Take that right arm and just bring it in a little closer towards your body. And over here, you're going to bring your heels closer towards your butt, and then you lift your pelvis up. Okay? Feel free to kind of just make some small circles with your body, with your hips. Massage it. Mindful of those traps not to come back towards the ears. Don't weigh your shoulders as your earrings. And release your pelvis, release your arms, relax. Now, let's try the same side but different position. So you're either gonna go higher or you're gonna go lower, okay? So just pick another spot, all up to you. Get fun with that whole area. That's a lot of tension. All right, once you find yourself there, please don't bring your pelvis up, not yet anyway. Left arm, open that up. Make it across your chest for 5. Breathe it in. Cross the chest for 4. Breathe it in. Open it up. Cross the chest for 3. And open it up. Breathe it in. Breathe out for 2. Big breath in here. Longer breath out and slow. Cross your chest. When you meet that end point, follow it along, which is bringing that in a little closer to that arm. Lift the pelvis up. Breathe here, please, for 4, 3, 2, 1. Release everything. Pelvis down and arms. Okay, let's shake that off. Let's switch sides. Now, you were working on that left side? Let's work that right. Here we go. You guys already know what to do. All right, right arm, open that up. Bring it in. This is 5. Breathe it in. Cross your chest. 4, 4. Breathe it in. Cross your chest for 3. If you need to reposition, not a problem. Just do that. For 2, bring it in as you breathe it out. Breathe it in. Last one. Big breath in. And longer, slower breath out as you make it across your body. Give it a little tug towards you. Lift your pelvis up. Breathe it in for 4, 3, 2, and 1. Release everything. Arm, pelvis down towards the floor. Reposition the ball. Go higher, go lower. Up to you. Find a good tender spot. Once you do, open that arm up. Let's go for 5 again. Bring it in. Breathe it out here, sorry. And breathe it in. Breathe it out for 4. Breathe it in. Especially those tender areas. Go slower on the breath out. That's 3. Breathe it in. Last 2. Cross your chest. Breathe it in. Big breath here. Big breath out as you bring it in. That's 1. Give a little tug towards your body. Lift your pelvis up. Hold. 4, 3, 2, 1. Bring it down. And release that ball off of it. And come back to a seated position. Okay, that was something, right? Shake it off. I personally like to release that at least every day. I know for those who did find that quite challenging. If it is challenging, if it did hurt, that's probably a good call to do it more. So feel free to do that at least twice a day, especially if you are sitting down. You don't want to let those muscles that we just released kind of set back to tension. Now, just allow me to kind of recheck of my work here. What was I doing? So, excuse me, guys. I'm with you. Okay. So what I had in mind was now we're going to work the neck. And in this case, we're going to actually get rid of the ball. And you're going to sit, either you could be kneeling on your mat, you could be sitting on your mat, it doesn't matter. I could use the floor as well. So let me just show you what we're going to do is we're going to work the back of these muscles, okay? So these muscles are called your extensors. Now, they tend to actually get weaker if you are really looking at, watching your phone, checking the news, especially if we're in this position all day. These neck muscles need to actually pull up and work, but they get tired and tight. So we're going to wake them up by use of these 4 fingers. Now, we're going to line those fingers up kind of close towards each other, but along the edges of your spine, okay? So the center part of your spine, you're gonna stay away from. So if you feel bone, that's not it. So you want to put your 4 fingers aligned up just like this, okay? And what I'm going to do, just please watch first, so I can't really see you, but you're going to pull away like this as you apply pressure, and you're going to look down, okay? And where those fingers stop is just kind of the side of your neck, and release. So we're gonna go about 6 of those, okay? Now don't think you gotta push your fingers and dig them in. All you have to do is just think you're spreading the muscles apart, okay? We're going to do 5 more. Here we go. So everyone's heads up. I should probably face it. And now we're gonna look down, spread the fingers, spread the muscles for 5, Come back up for 4. As you do this, be mindful of your traps not to come up with you, okay? We just released those. Let's bring those down. For 3. And up. For 2. And last one. And 1. Amazing. Now, we're going to release the base of the muscles in the base of your skull. Now, these muscles are very, very small. So like it's literally the size of the top part of your thumb. So we're going to use our thumbs to place right in the base of our skull. And I'm making a bit of a helmet with my hands, and I'm allowing my thumbs to dig upwards, not in, up, okay? So very important that your finger direction goes upwards this way, not in. So I'm going to go up like this. Hopefully you guys can see me. And I'm going to just make small little circles like this. All right. And if you do need some help, because this here is a bit more specific in terms of location, please feel free to unmute yourself and just say, Chris, help. If all is well, let's do this for another 4 breaths. 3, 2, and 1. So thumbs are still there. What my head is going to do is I'm going to look up and then down all the way. Okay, so applying pressure. Going to look up and down all the way. Okay, so what your fingers are trying to do is actually, your thumb actually is trying to bring the muscles and separate it from the rest of the neck. Up and down. Last 3, up and down. Last 2, up and down. Last one, up and down. Amazing. Now we're not quite done with that muscle, especially if you get headaches. That muscle is really good to release if you feel headaches in the back of your head or around the temporal area, okay? We are gonna get back to that muscle with the ball, but I wanna just release, since I have you up here, these guys. Now this long muscle here, man, does that ever get a lot of attention? Because of the movement we do this way. Especially every 15 degrees of neck flexion, that is like 50 pounds on your neck muscle or your neck, your cervical spine. So we don't want to loosely bend forward. You actually want to tuck your chin in and look down. But how do we do that when this long muscle gets really gunked up? So we're going to unlock that right now. What you're going to do, 2 fingers. You're going to place both of your fingers, and you have to explore it here. So just underneath your earlobe, okay, you kind of explore, and what you'll find is if you move actually forward, you're going to find more softer tissue. Now when you bring it back, you find a good tender or even harder muscle. That's what we want to release. Okay, so wish I was with you guys to see if you guys are on it, but you'll know if you actually push inwards towards your ear. So what it looks like, or what it feels like, is very hard muscle just underneath your earlobe. Okay, I want to say behind your ear, but everyone's ear is different. And what I'm going to do is just going to go push inwards, and I'm going to look, or not look, sorry, I'm going to open my mouth like this. Ah, and then I'm going to go down, okay? So 2 movements that are separate. Ah and down, okay? Let's do this all together. We're going for 4. So open the mouth, ah, and then down. Okay, I won't be able to talk while I do this. So open your mouth, ah, and then look down. Cool. Let's actually do 2 more. I lied. 2 more here. Open mouth, ah, and down. If you're not feeling much, please push in this way. Ah, and down. Cool. Again, this was actually supposed to be a part of another class. I know we're doing neck and shoulders, but I can't leave the jaws out of this. The jaw muscles are so important to release. It actually holds a lot of tension that we don't know, and maybe some of us do know. So how we're going to release that, 2 fingers again. And what we're gonna do, you're going to go, so find your jaw, not hard to find. And you're going to clench your teeth, okay? And if you find a muscle kind of pops up, that's it. That's the masseter muscle. Biggest muscle in your mouth right now. So what you wanna do, push inwards like this. Be gentle though, because it can be quite pissy. So push in, and what you're gonna do is just make small circles. And when you find a good tender spot, focus on that spot. So I'm kind of exploring, found a spot, I'm gonna dig right in there. It's a nice trigger point you can release. So I'm gonna shut up because it hurts when I talk. I'm gonna just stay here for 4, 3, 2, and 1. Now I allow my my fingers to kind of slowly dig into that muscle deeper. So let's do that again, but we're going to open the mouth like this. Slow, okay? So we're gonna go 4 counts of these. Here we go. Find that muscle, breath in, and open the mouth on the breath out. Stretch that jaw. That's 4. Here we go again. Close mouth and open. That's 4. Let's go 3 more here. That's, I think, 2 more here. Last count. 2. Last one. Good work, everyone. Cool. All right. We're not quite done the jaw. The chunky part of your thumb, love using this to release my jaw muscles like that. You can just kind of give it a good shake with all the deep work you just did. Okay? I kind of like to go the whole kind of chin strap here. So just give it some love. That jaw loves that attention because we use it so much. Eating, talking, you know, it just doesn't stop working. We don't release it enough. And that can exhibit a lot of headache pain in the temporal and neck pain. All right, again, I wanted to kind of find ourselves back to release this muscle. So we're going to find yourself back onto the floor with your lacrosse ball. How you guys doing so far? Good? Okay. All right. So we're going to place the ball one side at a time. Let's start with the left, base of the skull, okay? Little tricky because as we lay on top of it, the ball might want to shift and move. So you're going to have that right hand just to hold it, like that. Okay, so let's all come down towards the floor. Legs relax. So here you're going to allow your head to sink into the ball, okay? And if you do feel like, yeah, my ball's the ball is very supported, you can release the hand, okay? It's kind of a balancing act here at this point. So from this position, very, very small movements here, you're just gonna give a nod. So you're going to look down or chin tucked towards your neck. And then you're going to look behind you. Okay, so you're essentially kind of nodding, saying yes. So you're going to look down and look up. Let's go for 4 more reps here. Look down for 4. And up. Again, if the ball is moving, feel free to support it with the opposite hand. Look down for 3. And up. Look down for 2. And up. Feel free to apply more pressure. Bring the head right into that ball there. Last one. And up. And we're not quite done here. Okay. Please support the ball with your hand here, because now you're going to look towards the left side and back center. Okay? Here we go for 5 and center. For 4 and center. So base of the skull close to the spine. 3 and center. Last 2. And center. Rotate for 1 and center. Okay, now we're going to bring that ball just a little bit lower. Hold on. You know what? That might be a little bit too difficult for me to explain. Let's just release the other side. So, right side now. Ball just underneath the base of your skull. Legs release or relax. Left hand supports the ball if it needs to. And you're going to look down. So saying yes here and nodding by looking up. That's 5. Look down. Look up for 4. Look down. Look up for 3. Look down. Look up for 2. Last one, look down. And look up for 1. Okay. Now you're going to shake your head. So you're going to look towards the right side and center. That's 5. Right and center. Right side and center. 2 more. Look towards your right side and center. Last one. Right side and center. Okay, cool. Release the ball here. Now, here you're going to still lay on the floor. Allow me just to kind of talk you through this. We're going to now engage that muscle, the back of your spine. So the base of your skull. So if you do want to see at this point just what I'm doing, or just listen, all you got to do is your head is going to stay in a neutral position. So what that means is you're not looking down, you're not looking up. You're keeping it right into a neutral position, eyes locked forward. All you got to do is tuck your chin in towards your neck. Okay? Sometimes what I see people do is actually when I say tuck the chin into the neck, they look down. I mean, just try to give yourself a double chin. Okay? Now, the back of your head is on the floor. I want you to put some pressure into the floor by pushing the back of your head into that floor there while keeping that chin tucked into your neck, okay? So if you're already doing it, great. We're gonna hold that contraction for 6, 5, 4, 3, 2, 1. Release, relax, jut the chin forward if you need to. Reset, bring your head back to neutral, tuck the chin in, push the back of your head into the floor, hold for 6, 5, really hard, 4, 3, go, 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 2, 1, release, jut the chin forward, let it relax. And last time, tuck the chin in towards your neck, push, push, for 4, 3, 2, 1, and let's relax that. Okay, amazing. Let's all sit up here. Okay, cool. Janice, you too, please. Let's let's come back. Let's actually get onto our feet. Okay, let's shake it off. Let's get the whole body getting some blood here. All right, now let's reassess what we just did in the beginning. Okay, so allow me to just recall what we just did. So we're going to rotate towards our right side. And just allow yourself to see, does your chin move a little further? Is it on top of your collarbone this time, or is it even further? And switch it over to your left side. Okay? And if it does feel the same, which is okay, we just need to release certain points again. And what I would do is release that muscle that we just did here. Okay? And I would release the chest as well. So that will give you more range there. Just those two release. Pull, which is the first thing we did, and push. All right. Last but not least, you can just move your shoulders up like that. And what you're gonna do is you're gonna bend your elbows, bend from the elbows, and just try to get those elbows to push right towards the ceiling. Face the ceiling, I mean. So point it towards the ceiling and release here. Okay. If you ever do feel throughout the day your shoulders tend to get kind of tight, I just use that cop-out word. Honestly, when people try to stretch out their shoulders, I always say don't do that. Just get it moving in circles. So what I mean by that, cup your shoulders like with your hands, okay? Think your elbows are directing big circles backwards. This is the safest way for you to mobilize your shoulder joints. Now, people tend to do this with big arms, and that's never a good thing. So you want to cup your shoulders with your hands and think the elbows. Now, it's really hard to get it to point towards the ceiling, point back towards the back, and down. So that's where I would actually try to challenge my body, or my shoulders anyway, to actually look up, look to the back, and down. I mean, I'm sure you ladies have a lot more mobility than my shoulders do. Last thing we're gonna do is try to grab hold of your hands here. So right over left, and then left over right. Some of us will still feel imbalanced there, which is okay. Sometimes not all of us can reach it, and if you are reaching it, that's great. It'd be way more impressive if you could grab your elbows.
Hi again. Thank you so much. We really appreciate that. I feel amazing. I mean, it was painful, but.
And honestly, Liz, this was great. I had a lot of fun. I needed that too.
Yes, thank you so much. We really appreciate having you.